Cord. Okay. All right, I think we're all set now.
Okay.
So can everybody hear me?
Yes.
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 Okay, so I have to apologize. I had the minutes and there was a couple things I had to double check and I totally forgot to do it and I'm sorry.
Okay, we'll table the minutes till the next meeting. If well, we have to, we don't have the minutes, so we will.
Okay, I make a motion to table the minutes from the previous meeting until the next scheduled Board of Health meeting.
Okay,
Second.
Yes.
Yes.
Sue?
Yes.
Okay.
problem,
I
Jessica.
read the introductory comments. So now we're on to public comment. To public people. Peter, anything you'd like to ask now or say, or you want to wait till later?
Not at this time, no.
Joe? Okay. Tammy, your report. Good evening, by the way.
Good evening. I knew my laptop, my luck was going to run out soon. There's something wrong with the driver for the audio. Let's see. So my report for 12/17/2020. I did one Title V soil evaluation witnessing at 10 Crystal Drive. I had final inspections for septic systems at 286 Granville Road and 44 North Lake Avenue. I approved plans for septic systems at 255 Granville Road and 642 College Highway. Let's see, I attended part 2 of the Massachusetts Environmental Health Association's fall seminar regarding Title V. And there have been a myriad of meetings that we've had in regards to COVID-19 and COVID-19 vaccinations. Let's see, did I put on the agenda budget before COVID discussion or budget after? Does someone have that open?
After, but it doesn't make any difference. Change it if you like.
Okay. So the one thing that we needed to do this year was to request, we had to request an extra $1,000 to put into our nurse line item on the budget. And I'm thinking that maybe not knowing what the future is going to take us into 2021, that we probably keep that additional $1,000 for this year and try to request it. I'm just trying to think of going into it. If
Of the fiscal, so I'm confused here. We have the 1,000 in the budget already? Is that what you're saying?
we had to request it because sometime halfway through the year we ran out, and this is non-COVID related.
Okay.
So we had run out.
So you want us to request $1,000 from the select board? Is that what you're telling?
Yeah. So to put the budget at $2,000.
Sue?
Well, I mean, I'll write that into how I did it last year when I requested increases. So we don't go through the select board, but then we ask for the increase and then we meet with the financial committee, right?
Oh, so you want to do it for next year instead of 1,000 to put 2,000 in?
Yeah.
Okay, Sue, is that okay with you?
That's okay with me. How about you, Jean?
Yes, I'm fine with that.
Okay. Then we'll increase the budget. Put down another stuff. Joe?
Why don't you put it to 3,000? Because let's be realistic. This isn't over. And I know you can put some stuff off to COVID. I get that. You can always have a little extra at the end of the year versus coming back halfway through. I really suggest you bump that to 3,000.
I don't think anyone will argue with us if we wanted to go over. Not this year.
So, but just
Are you okay with it at 3,000?
That's a good idea, Joe.
Okay, Jean?
Oh, yeah. I wish I had thought of that.
Thank you, Joe. Okay, Tammy,
Okay.
3,000.
So I'll put that in there. On the plus side, new information has come out from the Department of Public Health that more local public health money will be available, grants will be available. They just kind of sent us a sort of cursory email letting us know it. They haven't sent anything out about filling out the grants or anything like that. But hopefully that'll be shortcoming. And I also found out that the Planning Commission had found that there was a way for us to reimburse any of the COVID monies spent on nursing without having to go through the CARES Act, because that only covers 75%. So we'll be able to cover the other end of it with this additional money from the state. So I had just basically sent them over what we had spent. I think we spent, after the first grant, the first two grants were up, that was about $13,700. After that, we spent, up until I think last week or the week before, about $7,600 for nursing, public health nursing. So they might be able to reimburse that $7,000, which that would have gone, and it could have been for CARES Act funding, but it wouldn't have reimbursed. Only 75% of that would have been reimbursed the town. So that's pretty good news. We were wondering whether or not they were going to do another one of those grant cycles for local public health, and that's fantastic. Really, as for anything else on the list, I mean, supplies, immunization clinics, I don't know whether or not we should increase those. I am getting reimbursed for materials for potential clinics by this grant from the state. They're giving us up to $1,500. So I can get, I want to get for a outdoor, any type of outdoor clinics would be a tent and maybe some additional safety cones, so I don't have to steal them off of Mr. Didi. And just kind of have that in our pocket for any future clinics that we might be having. And we'll be continuing, pushing flu clinics for the foreseeable future. I really hope that, this will stick with us past the pandemic. So
I'm thinking that, Tammy, that line item might be also increased. If you're thinking about flu clinics, and
so
if you actually have the vaccine for the COVID, and that may be applied as you get the doses. So you may have, like more than one, 4, 5, or 6 clinics for the dose dispensing.
So here's my.
Oh, I'm sorry. I was just telling you the budget for, it's $556 is our immunization clinics budget.
Yeah, I don't think that's going to be enough.
Hold on. So let me make a point. I think before this year, we didn't, at least the last few years, we didn't have any budget. We didn't do any clinics. The board didn't do any. We're asking enough from the select board. Budgets are tight enough. If we need the money for a clinic, I am sure that we will be able to get it. I just think that we should be a little frugal on what we ask the select board outside of COVID stuff at this point. So it probably sends a good message. And if we need the money for the clinic, then we'll ask for it at the time. But right now, I don't think we need it, and I don't think we should ask for it because the select board has been very generous with our recommendations. And also, we've gone through this where people can get their flu shots mostly free anywhere that if they have insurance, and if they don't, they're probably free too somewhere. So that's my point. I think that at this point, I would rather not go to the select board for anything outside of COVID if we can help it. Sue?
Now, Joe, what do you think?
What do I think?
But would we be going? We would be going to the financial committee, right? This is just not an additional request. This would just be budget
I
amendment.
understand that. And at this point, I would rather not put anything more in our budget that we don't have to, because everybody's been, but all the town's budgets that have holes in them, and they're going to continue to get holes in them. So I think it sends a better message, look-wise, to try and ask as least as possible from the finance committee, unless we absolutely need to have it. And we don't need to have another $443.70 in the budget. If we need it, we can get it, I would assume. And if the town doesn't have it, we won't get it. But right now, I don't think it needs to be in the budget. I don't want to ask for anything more than we have to. So that's my opinion. Sue?
I don't have an opinion either way. How about you, Jean?
Well, obviously, it's going to be a moot point, so
Okay.
never mind.
Yeah, thank you. Okay, we'll leave it the way it is.
Yeah, there will be ways to find funding for.
Absolutely. That's what we've never been turned down, and we're not going to be turned. I would imagine we wouldn't be turned down for clinics that we need. And again, I'll reiterate, the last 4 or 5 years, we didn't fund any clinics, any flu clinics in town, because everybody that wanted a flu shot in Southwick got one, as far as I could tell. All right, send my piece. Tammy.
Okay, where was I? Oops. I think that's really all I had to say about the budget.
Okay.
Was that the nurses line item. Maybe, Kate want to go into updates. I have Kate, I have your graph. I can put that one up on.
Sure. The pretty one? The pink one? I made it pink and yellow. It's very, very flashy.
Hey, wait a minute. Go back to the budget for a minute. I don't know if this is something we can talk about at the meeting, but was there something in Tammy's contract for increase in salary or something after the first year? I don't have it in front of me.
I think we were going to go along with what the select board decided to give the other directors. Is that, I don't have the contract in front of me, Sue, so I can't answer your question.
Yeah. Do you remember what it says, Tammy?
Yeah, after a 6-month period, which is when you guys evaluated me, I went up $1,000.
Well, was there anything there that says after a year?
No.
So it'd just be the regular cost of living that the selectmen give out or what the finance give out? Yes, no?
I don't remember.
Okay.
Let's get someone, Tammy, you have a copy of the contract?
Not on me, I'm at home.
Would you do it? You do? We'll take a look at it. If it calls for a raise, fine. If it calls for, and I believe we leave it up. We have always left it up to the select board to give at this point. Joe, go ahead.
Sorry. Yeah, I mean, you guys are in charge of her when it comes to that. Oh, am I still there? I am. Okay. So you guys are in charge of her when it comes to that. And I think in years past, sometimes the Board of Health did get overlooked because it really doesn't fall under the select board in our issue. So Tammy, definitely look into it and speak to Jerry and figure that all out, or even grab Carl, and you should be all set either way. So just don't go by what you think us selectmen think we know. We know nothing. So that's a question for Tammy, Carl, and Jerry, and you guys, definitely get on top of that.
Why don't we get a copy of the contract, take a look and see what it says.
Okie doke.
Okey doke.
This sorry, but I didn't save it the right way. I should have saved it in a PDF, so that's why it's all fuzzy. If everybody is on, if your pictures are on the right side of the screen, you might want to just drag them and pull them to the left, because that would be the most recent data so that you can see it.
Oh, look at this.
All right. Take it away. Hey.
Okay, so so this graph is showing, excuse me, data from November 1st, basically, to December 15th. So in the pink, that is how many people were tested. The yellow is how many were positive. And then this is the percentage, which I don't know if you can really see, but it's basically dividing the positive from who's been tested. So this first 5 days, right, 6.80% of the people tested were positive. And then you can see it kind of dips down a little bit. So now we're talking like getting into the 2 weeks after Halloween, right? We're okay. But the testing went down significantly. That's why our percentages are sky high. Then now you're getting into the 3rd week post Halloween. So that was a very busy week. Then it kind of dipped down again. And then, so it's kind of like a little roller coaster here. It's been very interesting. But the trend is definitely, I think, going down. And I'm hoping it continues to go down, because we continue to be in the red. So we just had our 5th week in red. There's been 7,138 people tested in Southwick out of, I believe the population per state is 9,800. The total positive tests for the past 14 days was 51. So 25 or less would bring us out of the red. Although the percentage was lower, which is good, right? So our percentages are going down, but they're still in the red. And then I also looked at Hampden County. So Hampden County this week is at 8.55. So we are becoming or going lower than Hampden County, which makes me feel good. A few weeks ago, we were actually higher than Hampden County.
So Kate, the next week, would you say 11th to the 15th, and the next week would Thanksgiving would come into that with those numbers? Just like we had a spike after Halloween.
Yes. So the numbers from let's see, the week. Yeah. So this week is covering the days between 11/29 and 12/12. So if you went the week before, it was going up a little bit after Halloween. I don't see between 11/29 and 12/12, there were the 53 cases, but now going into early December. So when we look at the next reporting period from the state, which is 12/6 to 12/19, we want to be less than 25. We're already at 29. So we're going to be in the red again. However, I'm hoping that percentage, the percentage positive over the 14-day window, will continue to lower. And we want to make sure or look at, are we lower than Hampden County? And those are key metrics that we look at a lot between the school system, the school nurses, Tammy and myself. We constantly share information to make sure that we are tracing and contacting every single person and their contacts.
So Kate,
Yes.
so I could read this. So between December 12th and 15th, there was 97 people tested. Am I reading that right?
The 11th and 15th, 11, this one here.
Yeah.
Oh, 11, there was, yeah, it's hard to say. Let me get my sheet here. It was 97.
Okay, and 12 of those are positive.
Yes.
So our percentage right now is 12%?
No, it's just for those days. So it's not, I just kind of chunk the days in 5-day increments.
So what is our percent then right now?
Our percent right now is 6.54.
Okay, and Hamden County is 8 something, right?
8.55.
Okay.
That is correct. So Hamden County is kind of been creeping up, if you think of it that way, and we're starting to creep lower, which it's, you know, that's not to say Hamden County we want to go up, but at least we're going lower than the Hamden County percentage.
Do you know, like what's the age now, the average age?
Oh, it's mostly families. So you're talking anywhere from young kids and families, 9, 10, 12, 14-year-olds to the parents. Looking at...
Can you trace it back to the schools?
No.
Work or anything? No common denominator?
Nope.
Do you have like a breakdown asymptomatic versus symptomatic?
No, I don't look at that. I look at quarantine and isolation numbers. I would say if I had to think asymptomatic when I talk to them, I'm going to say 80-90% are symptomatic. Yeah.
Can you define again the difference between quarantine and isolation?
Yeah, the only difference is isolation means that you're infected, and you have a isolation period of 10 days.
Okay.
So to clarify that, what that means is whatever comes first, whether the symptoms come first or the test date comes first, that's when you start the counting, which has been very confusing to people. The people that are in quarantine are close contacts. So they have not been tested, but they might be a household member that needs to separate from the positive member of the family. Mm-hmm. And hopefully that they don't get symptomatic and they don't need to be tested. That's very hard for some families.
You know, if somebody is asymptomatic and they tested positive, mm-hmm. So they isolate for 10 days. Mm-hmm. Do they get tested again?
No. And the reason they do not, the virus, so after the 10 days, they are no longer what we call infectious. Okay. So they can't expose somebody else to the virus. But the virus is living in the body and it's building antibodies for 3 to 4 months after the infection stops or the infectious period stops. So to test a month after, they're going to still be positive. All 2 months later, positive. So I have seen actually this week, I have seen 3 or 4 people that tested back in June positive, and now they're testing negative. And there's no evidence on reinfection that I'm aware of.
It doesn't say much about the viability.
What's that, Sue?
It doesn't say much about the viability of the antibody. You know,
well, that's why the vaccine, to build more, but it's waning. Yeah, it is. It's waning. And in case anybody asks, if somebody has tested positive, they still should get the vaccine.
Okay.
They absolutely should. There's no detriment to getting it. Jerry, did you have a question?
I think you answered it.
Okay.
I'll get to my vaccine questions later.
Okay. So currently we have 18 individuals in isolation, 13 in quarantine. Again, I'm seeing more families affected by, one person getting testing positive, and then they're waiting the 5-6 days instead of doing the quarantining with where they don't need to test. They are getting tested, and most of them are coming back positive.
Kate, what were we 2 weeks ago as far as isolation and quarantine?
Oh, I don't know. I'd have to look at my notes. We were much, much higher. I think in the 40s for both.
Okay.
Mm-hmm. Yeah.
Oh, yeah. Last Monday was when they changed the quarantine guidelines.
Yeah. So you can be in one of 3 different quarantines now. I mean, I
know.
Yeah, there's the 7-day strict quarantine with testing after the 5th day and returning to life on the 8th day, as long as you continue to monitor yourself for symptoms for 14 days.
Mm-hmm.
Then there's the 10-day strict quarantine, which doesn't require a test.
No, but you don't need one, right?
Requires you for 14 days to continue to monitor yourself. And then I'm not sure I get the 14-day option. That is for people who continue to have symptoms or have symptoms that test negative.
Yeah, if they have any symptoms during the quarantine period, even if they test negative. So if they're symptomatic but still test negative, they still have to do the 14 days.
This isn't confusing at all.
It's very, very complex. And let me tell you this also. Try to apply that to a family of 7. Anyone want to do that job for me?
Yeah.
Trying to apply this to a large family is very complex. So go ahead, Jean. I'm sorry to interrupt you.
No, Tammy, can you just bring the graph down now?
Oh,
I have a problem with my volume on my computer and I can't do it.
Yeah, we don't need that anymore. Sorry.
There you go. Thank you.
I just got used to it because I've been joking to Kate that I was looking for a more hot pink graphic, and she actually did give me.
Well, my volume was like at 200 and I had to turn it down and I couldn't because the graph was there. Okay, sorry to interrupt. Go ahead.
Kate, do we have anybody in the hospital?
We have 1 person in the hospital, and we've had 2 ER transports this week. Mm-hmm.
So 3.
Yep.
And was it last week we had somebody pass away?
Yes.
So what's the total now?
3.
I think it's 5.
5?
I believe so.
Pre-existing conditions?
Yep.
Okay.
Yep.
8?
Late 70s, early 80s.
Oh,
Yeah.
5.
This person, unfortunately, was in Boston, so there was no chance of family, but they did talk on the phone, which was a blessing. But tough. Yeah. Any other questions for me?
Yeah, a total positive since it started.
Oh, geez,
215?
Let's see. No, I think it's up to 260, 258, 260 since March 1st.
260. And how many?
I thought it was going to hit 100.
And how many people tested?
Oh, 7138 total tests.
71,000.
No, 7,138.
7,000. Okay.
Yeah.
7,000.
Yep. And that's only, right. So it's only counting the first time you test positive, right? It's not looking at duplicate, repeats, negatives. It's all. So if you calculate that out,
3%
of our population,
it's about 3%.
9,800, 7,138 divided by 9,800. So 73% have been tested. That's not bad.
73% of the people in Southwick. That's a lot.
Yeah. It is a lot. I think it's a lot.
Yeah, it is a lot.
I have a question for you. If you're in college and you're living at school out of state or whatever, and you get tested and you're positive, where is that recorded? In the town that you're residing, or
goes to the college?
It would go to the college.
It does.
Okay.
Yep.
But you would normally get it and then kick it back to them. Is that what would happen? Or
I do, and I talk to the students and they tell me they're being monitored and quarantined. Like, I still talk to them, but it doesn't go towards our data. It actually goes to the state town where they're in school. But I still need to reach out to them to make sure that they're, you know, they're getting the right guidance. So I still talk to them, and they're very, very cute. But I haven't had a college student in a while. Probably not since like September-ish.
I don't think a lot of those colleges are in session in person right now.
True. It's true. Yeah, that kind of went away quick.
I think a lot of colleges got punished, or students got punished once numbers were going up. I think over.
They were co-mingling in places they shouldn't have been co-mingling. Right. But no, I haven't had a college kid since I probably late September, October. It's only been a handful. Anything else that I can answer?
Tammy, are you going to get to the vaccine now, or?
I was going to first just go over, so last Tuesday, the governor went on and he had proposed all of his new COVID initiatives. And he had announced that the entire state was rolling back to phase 3, step 1 with additional restrictions. And that started on Monday of this week, the 13th. We actually had to wait all the way until I think it was Sunday to get the actual physical guidelines posted, because they hadn't posted any of that stuff. And luckily Jess, she was awesome. She made lists of our businesses that we have on hand, so that I could send them information on how the rollback changed their businesses. For some other additional ones, Karen, our new inspectional services secretary, she went through the building department files, and she pulled up all of the occupancy numbers for businesses and other organizations so that I could send them. These are for ones that are most affected by us. So that I could send them their numbers so that they could plan appropriately, because some of the places, some places that did have occupancy restrictions went from 50% occupancy to 40%. And then there was some additional information for the restaurants about time limits for parties, going back down to only 6 people per table, no inside or outside musical entertainment, and quite a bit of a list of not a lot of changes, just a handful of changes that were added on to the step 1 guidance. But it's pretty much the same as we had when we were in step 1 before. And we've already been step 1 for a couple weeks anyway, because we've been in the red for 5 weeks. So a lot of the stuff isn't new. It's just the additional restrictions that were new. So that is that for, and it's the state continues to comment on why we're calling it reopening information, since we've been reopened for quite some time, but they haven't decided to change that yet. So on to vaccine planning. I've had
wait a minute.
Oh, okay.
Back to our favorite subject, the church.
So I just pointed out in the last time we talked about it that the last time I had visited, it was before the new mask orders were in place, and it was when it was either social distance or wear a mask. It wasn't both. Now it's both. So I actually sent them a letter, certified mail, with all the information. I contacted this organization, CEIT, within Department of Public Health at the state. They translated documents for me. And so now they have all the newest information that they could possibly ever need. They've got flyers, they've got documents, they've got everything.
Did they pick up the certified envelope?
I don't know if I have that yet. I sent a bunch of certified letters this week, so I haven't seen whether or not I've got it yet. But I send everything certified, and I send also snail mail or regular mail. So, but I did that for all of our places of worship in town. I had Karen find the number, and I calculated percentages and everything like that. Yeah. Okay, do you want me to go on to the COVID vaccine stuff?
Yes.
Do you?
So Jane's muted, but that's okay.
Yes.
You all set to go on to
I'm fine.
vaccine? Okay, go ahead, Tim.
I didn't go over the presentation from the state, right? I'm honestly don't remember. I've showed it to a few different people, and I can't remember if I did it at the last meeting. Did I?
What presentation?
The COVID-19 vaccination presentation?
No,
I can't
I
remember.
don't think you did.
Okay. I did it for a few different groups, so I wasn't sure whether or not I had done it. Hold on. Let me just open up this document. All right. Okay. All right. Not as smooth as I wanted. Sorry, guys. Okay. Let me just do a full screen view. And you can hide our picture by clicking the smallest little icon in the picture box that has it's more like a little line that'll hide your picture so you can look at the full screen. So last week, this is the state put this up on their website. It kind of gives a little timeline and kind of talks about the priorities. We sort of talked about the phases in the last one, but I figured this one is really this one kind of highlights it a little nicer. This is so if you go up on the state's website and you go to the COVID-19 page, there's an icon. It's a COVID-19 vaccine, and you can find all this under there. But so it kind of breaks it up in the phases: phase 1, phase 2, phase 3. So phase 1 is what's starting right now. The hospitals are getting it. And we talked about this before. So we have long-term care, assisted living, hospitals, our public safety, home-based healthcare workers, and other healthcare workers who might have some contact, but not direct facing contact for COVID cases. And then we would move into phase 2, and this would be we'd be a little more specific for people with multiple comorbidities in certain types of sectors that are affected by the shutdown, such as early education, K-12, grocery, agriculture, sanitation, public works. Then we go on to adults 65 plus, individuals with one comorbidity, and then we would move to phase 3, which is the vaccine is available to general public. We would start getting involved somewhere under where it says adult 65 plus, individuals comorbidity, and then vaccine available to the general public. So that's looking more like a March, April timeline for local public health to get involved directly, at least, with handing out vaccinations. This one kind of does it a little better. Kind of gives you the cute little images that they put up. It's exactly the same thing that was on the first page.
Does anybody know if the people at the cottages have started to get immunized?
I don't believe they had them. If the only places that would be getting it right now would be like the skilled nursing portions, not just senior living. So skilled nursing is on the list to go in, but as far as I know, I think the first doses have been handed out to hospitals so far. I'm not sure. I don't believe that they've gone skilled nursing quite yet. But that is something that, we've kind of been talking about in conversation. So last week I started meeting with counterparts for the county and the state to kind of start talking about planning. But one thing that we have learned is that they know very little about how things are going to happen on our end either. So, but this week we had a meeting with sort of kind of our incident command team in town, and I went over everything I know so far and most of the speculation that is coming down from the state on what we'll be looking at, come the late winter, early spring. So they put up, there's some information about vaccine safety on the websites. There's plenty of great websites that talk about vaccine safety and what's the word I'm looking for? Vaccine promotion. This kind of just talks about equitable distribution and health equity, making sure that the right people are getting the vaccines at the right time. And like I said, there's a lot of great information on the Mass website if you go to COVID vaccine. Do you want to look at any more of this, or do you want me to put it down?
So,
I think we should look at it.
Does anyone want me to go back to any of the slides in particular?
No, I'm all set.
Jean?
I'm all set, thank you.
Okay, so I'll just stop.
Okay, Tammy, go ahead.
Okay. It's a nice little presentation that they gave, and it kind of gives a little overview, which is great. Like I said earlier this week, I met with our incident command teams, which police and fire, our emergency management director, Carl Steinhardt. So we all kind of, and our county rep and our state rep for emergency preparedness was there to kind of guide us along in the conversation. And there's a lot of information that really isn't out there. Like we don't, a lot of the expectations on municipalities they haven't put forth any expectations as to how big of a role we'll have in vaccinating on the population. I think because the options to get it at your healthcare provider and through the pharmacies commercially, just like we do flu, it's decreasing the need for us to do it. But what they're thinking is that we'll probably be vaccinating similar to like the senior flu clinics and things like that to come. So one of the problems we had was that Jess wasn't getting any response from Bay State to signing our healthcare consultant agreements. And it was getting a little frustrating because as Kate knows, the information for the application to become a distributor of COVID-19 vaccine came in, and we couldn't fill it out until we actually had our provider on hand. And it was just really happenstance that I was talking to our county coordinator, and he said he was talking to Mr. Fitzgerald about Granville, and that he had just found somebody in Bay State, and Tom gave me the contact, and we already have the contract signed, and we're good to go. And I worked on I almost finished, but the snowstorm, I would have done it today. So our application will be finished by tomorrow for it. So that's, I'm sorry?
Who's our provider?
We're using the exact same provider that, that local EMS uses, and several other towns, Dr. Beltran with Bay State Disaster Medical Services.
So is that going to be our Board of Health physician?
Yeah, I didn't realize that I had worked with him in the past, and until I had seen something that he signed, and he signed it with his nickname, and I was, really nice, really knowledgeable, and in this situation, definitely knowledgeable, seeing as we are in a state of emergency, which is good. I think things worked out great on that line. So, and
Jerry and Jean, who was our past provider? You know?
I have no idea. I know we signed the contract with it 3 years ago with Bay State, and somebody, I have no clue. Just that we had standing orders.
Was that a woman?
Ramajan Shumaswamy.
Kupaswamy.
It was Kupaswamy.
Oh, it was Kupaswamy.
Okay.
Oh, okay.
Thank you, Jean.
So that was great that we got that under control.
Yeah.
And
Thank you.
And so some of the things, so public safety is coming, is in the first phase. And I know, so OcuHealth, which has the contract for fire and police, they've had their application received to dispense vaccine. So we're thinking that that's probably how, in that first wave, how our public safety is going to get vaccinated. But there's a lot of discussions on their end as to how that's going down. So that part I'm not too super privy to. But it looks like things are moving and things are in motion, and I'm interested to find out the next bit of information. But not too much has changed since the last meeting, other than talking more about it.
Can I just add a couple things to Tammy? So I had taken notes at a webinar, which was very good. They're trying to figure out who can administer the vaccine. So pharmacists, right, paramedics, no EMTs. They will be able to bill. So there should be no cost to individuals. And to keep in mind that everyone needs 2 doses 3 to 4 weeks apart. So they're coming up, there's an app. Let's see if I have the name of it. There's a phone app called VSafe.
The state was saying 6 weeks apart, but I don't know if that's different for different vaccines.
One is 21 days and one is 28 days.
Pfizer's 28, Modera's 21.
Who's telling me 6 weeks then?
Well, that's not what we hear. I heard. So
That must be AstraZeneca.
Oh, maybe. Yeah, because at one of the meetings, because that was the thing. It was if you could only refrigerate for 30 days, but you have to have it for 6 weeks, then there's an overlap there, so you'd have to freeze. But
Kate,
no.
Are you finished, Kate? Or you have?
Yeah. So I'm just throwing it out there that with different manufacturers, you might get a Pfizer one, you might get a Moderna one. They're trying to make sure you get the same, but I don't know what that's going to look like. I'm going to assume a lot of people are going to get different manufacturers, but they do have to be, somewhat apart. So
It's my understanding that the Board of Registration in Dentistry is going to take up the subject about letting dentists inoculate, give the vaccine.
Yeah.
So that's on the table for their January 6th meeting.
The more the merrier.
Increase the number of providers, but
Right.
it's up to them and the governor.
Yeah.
So whoever decides those things. So that's on the table.
Yes, I think same thing with EMS, EMTs.
I mean, if a medical assistant can give a vaccine in a pediatrician office, then I would hope that they could do that in a clinic, you know, with supervision and support. I don't know. I hope they don't, you know, kind of cut those resources off. But I guess the state will decide.
So my question, Kate, to you is that when it gets down to, you know, more than 3 people at a time, do we do it like we did at swine flu, where we did it at the auditorium? And so Tammy's shaking her head. So what, you have an answer to that?
It's not going to look like anything like that. At the most, we'll probably be doing clinics of, I'm guessing, 50 people. They're going to have to be spread apart so that we can watch them for the, what they call it, period afterwards, the reactionary period.
Mm-hmm.
So we're going to have to register. This will not be walk-in. It will be registration first. And very carefully put together, because we don't want a lot of people hanging out, and we certainly don't, you know, ideally I'd like this to be outdoors. And if we're talking springtime, I think that'll work out better, but we've talked about a couple different options. But I don't think, not a big thing in a auditorium.
Okay.
It's sort of counter to everything that we've been doing for the last 10 months, getting lots of people together. So
I'll be curious to see how many want it too, you know, so there might be, that's hard to tell too, unless you register people, you know. Are you getting hundreds and hundreds of people that want to register? Are you getting 30s and 40s? I mean, that will drive the type of clinic that we can do.
Yeah, some polls say 60% of the population want. I've seen other polls that said 30.
Yeah, it's hard to tell. It's hard to tell. We'll know when it shows up.
Tammy, anything else?
That's all I got.
Okay, I want to double back to the budget, because I didn't realize the budget hearings are in February. Is that right, Joe? Early February? So let's double back to Tammy's contract. I mean, it was signed before this COVID. Do you guys want to visit the amount of compensation that she is going to get? Do you want to increase it ourselves and go to the finance committee, or do you want to leave it to the select board? Because as far as what I could tell, what Joe said was that it's up to us.
Well, Jerry, you remember when we went through all this a year ago?
Yeah.
We were the ones that set up the contract. We were the ones that set the pricing. We were the ones that sent the termination. The health director is under the purview of the Board of Health, not the select board. So
whatever's in the contract, you want to leave it, or do we want to increase it because of what the extra work that Tammy's had to do in connection with the pandemic?
I'd like to see the contract, Tammy. Can you scan and email it to me, please?
Certainly.
All of us.
To all of us.
Yeah. It's true that the board can, yes, we determine what, but if the finance committee and the select board doesn't appropriate the money, then it can't happen. So there's no reason, you don't want to go to the select board and say, listen, we've given her, $18,000 raise because we want to catch her up. So I know. what I'm saying is that in the past, we've gone, but I think this different circumstances this year. And I think I want to look at, you know, do you want to add more than what's in the contract, or just want to leave what the contract says? So why don't we just take a look at it and talk about it the next meeting? Is that okay with you, Sue?
Yes.
Jean?
Yeah, I don't.
Joe,
Yeah.
go ahead. You were going to say?
No, I was just saying. I don't think we're going to have one more meeting before, at least one more meeting before our budget.
Joe, what were you going to say?
Just my input. So when we look at the town as a whole, it's usually a percentage, Jerry, whether it's like a 2% of their gross is kind of where we are usually at for, say, the average person. But I'm pretty sure Tammy's a department head, correct?
Correct.
Is that how? Right. So that's usually different too. So that it's, but when you do look at math, it does come down to percentages, whether it's 2, 3, 4, whatever it is. So that's kind of how we do it. I mean, you could say it's 1,000, but we still back it up and look at the percentage of that person's pay, just to, you know, do a mental check of what the percentage is. So just information. But I believe she is a department head, so it is a little different than the average employee that's not in a union. I'll shut up.
Hey, Joe, when you look at the department heads and they get a % increase, is it the same percentage for all the department heads?
No, what they call it in my world is a letter of understanding if they don't have a contract. So, and it varies. It really does. I mean, you know, Carl kind of handles 99.9% of that and then reports back to us of what they may or may not be. And then we discuss it and agree or not agree or tweak it in a different way, whatever that may be. So it's not just a standard percentage. It's whatever they're, like I say, we call it a contract. I think she has a contract, not a letter of understanding. So everyone's different. You know, you look at the employee and you look at their worth and what's really going on in life. And, you know, some people, I think we still underpay. Some people, I'll just shut up. But some people, I think we overpay. It is what it is, you know, and I'm not, and it's Joe's version of hell. So I'll just shut up.
So
Thank you.
I'll agree with Joe here. You know, we've just become a full-time department this last year. And before...
Thank God you did.
Well, I know, just law of unintended consequences.
Yeah.
Okay, so I'll drop it. We'll look at the contract and see what we want to do. Jean, is that okay with you?
It's fine with me.
Sue?
Yes.
Okay. Peter, anything, questions? Okay, I don't know if Peter's there.
I have a question for Kate. Kate, who's going to do the contact tracing while you're on sabbatical during the holidays?
Well, Tammy and I have an amazing plan. So this is what's going to happen. When a case comes in to Maven, which is our statewide database, if it's not addressed by the local public health nurse in terms of starting the initiation of the investigation, what happens is after 24 hours, it will roll over to the CTC. And we have a plan with CTC that I would be, you know, unavailable for those 7 or 8 days. So those cases will roll over for the contact tracing. I will still be able to see them when I get back. In terms of communication with the police and the fire, because every morning I give them an update of addresses to add. So for dispatch, and then depending on what's happening in the family at that address, I also tell them when to remove an address. So I gave Tammy directions of how to go into Maven, and you can pull a report for first responders that have just the address, no names, and the date of the first positive test. And then she's gonna take that information and share it with the chiefs. And then they will let dispatch know what those addresses are. And I think that's the best that we can do.
And it's great that we have Monica, the liaison to the CTC, and she knows our, you know, she knows what we need. And she said she's even willing to pull up reports for me. But I've been running a couple reports every once in a while just to see if I can do it or if need be for information. So, and you know, I know how to check Maven, and if need be, I've done some of the contact tracing. You've coached me through it, so we'll be good.
Yep.
Okay.
Let's just hope everybody else is good.
That's right.
Stays home, no giant parties, and
Hey, when will you
a
be
cozy little Christmas.
unavailable?
What's that?
What days will you be unavailable?
December 23rd through January 3rd. And then I'll be coming back on the 4th. The 4th is a Monday. I'm going to Puerto Rico.
All right.
Yeah.
And the town hall, is the town hall closed Christmas Eve and Christmas? What's the?
Christmas Eve and Christmas.
And then
New Year's Day. Just New Year's Day.
Just New Year's Day. Okay, so that's just 1, 2, 3. All right.
Peter, are you there?
Yes, sorry. Hope you guys weren't trying to.
No, I just want to know if you had any questions or comments.
No, I was actually away from my computer for like 5 minutes there. So,
We caught you, Peter.
no, not at this time.
Sue? Anything?
I'm all set.
Kate?
No,
I'm all
good.
set.
Thank
James
you.
all said. Tammy, anything else to add?
No.
Joe? Okay, I take a motion to adjourn.
But no, wait a minute. Is the next meeting New Year's Eve?
No, it's
Seven.
The
the
7th.
7th.
It's the 7th.
Mhm.
So how many weeks is that? 3?
3.
Do we want to go 3 weeks?
Well, the
Well,
next
we have the
meeting-
holiday week, so Christmas Eve is a Thursday. New Year's Eve is a Thursday, and
So
then
do you want to
Right.
make it for like the 22nd, which would be that Tuesday?
It's a Tuesday. Yeah.
No, that's probably, I don't know. What do you think, Tammy?
I mean, I'll keep you guys posted if there's anything
Yeah.
that really needs to be addressed. I mean, it looks like we're kind of in limbo for a lot of things right now, kind of holding on, and
You couldn't do a meeting on the 22nd because you don't have the 48 hours advance notice anyways.
Oh, I'm sorry.
Yeah.
Okay.
Yeah.
Next meeting's the 7th unless Tammy needs to get a hold of us.
Okay, and then Kate will be back by then.
Mm-hmm. I will.
Okay. I got a motion to adjourn.
I motion to adjourn.
Second, Sue,
Second in favor, yes.
Jean,
In favor, yes.
Jerry, yes.
Everyone enjoy
Everybody.
their holidays.
Okay, you
Enjoy
too.
your